Hello, everyone. This is Congresswoman Shontel Brown. It is an honor to be with you here today for our OH-11 Medicare Open Enrollment webinar. Medicare Open Enrollment runs through December 7th, and during Open Enrollment, you can compare plans for 2024 and find out what works best for you. Medicare is a promise. I know how important it is to people across my district and across Ohio. When it comes to legislation, I want to protect Medicare and make it stronger. And that's why I was proud to vote for the Inflation Reduction Act, which is lowering drug prices, ensuring that key vaccines are free, and capping the cost of insulin. And in Ohio's 11th district, I want to make sure my constituents have the resources they need to take advantage of the benefits they've earned and deserve. That's what this webinar is all about. After today's event is concluded, we will post this webinar online. And if you have any questions about your coverage, open enrollment, or anything else, please contact my office at 216-522-4900. We can help. I want to welcome Greg McAllister to this webinar and virtually to OH-11. Greg is with the Centers for Medicare and Medicaid Services, the federal agency that administers Medicare. Greg is a real expert and is here to present on Medicare open enrollment, Marketplace open enrollment, and Medicaid. Right now, CMS is working with their partners to help folks get covered however they can. He'll also share information on the Inflation Reduction Act, the Medicare Savings Program, and Part D extra help. So with that, it is my pleasure to turn it over to you, Greg. The floor is yours.
Thank you, Congresswoman Brown. Thank you to you and your staff for inviting me here today. I'm happy to meet with you and share some of this important Medicare information. As Congresswoman Brown said, I'll be talking mostly about Medicare open enrollment, but I'll also be talking about a little bit more in depth about the Inflation Reduction Act and some of the other priorities that are going on in our programs right now. So as the Congresswoman said, we are now in the middle of Medicare open enrollment. It starts October 15th every year and runs until December 7th. And before we get started, just a little disclaimer. This information is current at the time of presentation, but Medicare policy is subject to change. The contents of this document do not have the force and effect of law and are not meant to bind the public in any way unless specifically incorporated into a contract. This document is intended only to provide clarity to the public regarding existing requirements under the law. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense. Now, before we get started, just very basic information. There are two ways that people with Medicare get their Medicare benefits. One is through original Medicare. That's what we call when you have just Medicare Part A or Medicare Part A and B, but you don't get your benefits through a Medicare Advantage plan. If you are in original Medicare and you want to stay in original Medicare, this presentation is not for you. You don't have to do a thing during the Medicare open enrollment period. You can just stay as you are. This is especially important if you have other coverage such as through retiree coverage or a Medigap plan. Especially with a Medigap plan, sometimes if you enroll in a Medicare Advantage plan when you have Medigap coverage, that will disenroll you from your Medigap coverage and you won't be able to get it back. So it's very important. This is especially important as marketers talk with you or call you or try to persuade you to join a Medicare Advantage plan. If you are in original Medicare and you like your plan, you want to stay in your plan, you don't do a thing during this open enrollment period. But the numbers have been rising a lot. Now we're up to, I think, just over half of people with Medicare get their Medicare through a Medicare Advantage plan. And these are very popular. You get the same benefits that you get in original Medicare, but the reason that Medicare Advantage plans appeal to some people is because most Medicare Advantage plans offer extra benefits. The most common extra benefits are things like some vision or dental coverage or a silver sneakers program to help you towards a gym membership. and original Medicare does not offer that. And if you're in a Medicare Advantage plan, there's also a maximum out-of-pocket amount that you will spend each year for covered services. So that'll protect you in the case of catastrophic medical situation that would otherwise entail a lot of out-of-pocket costs. Medicare Advantage plans do have an out-of-pocket limit. Now, the one thing that you must keep track of if you are in a Medicare Advantage plan is Medicare Advantage plans do have networks, and depending on the type of plan you're in, like if you're in a HMO, health maintenance organization, you generally can only use the providers that are in your plan's network, except for in emergency situations. And then there's other plans, PPOs, preferred provider organizations, where you'll pay less out of pocket if you go to an in-network provider, but you can generally go to out-of-network providers and pay a little bit more. So those are the two main ways that people get their Medicare coverage. We're going to talk today about the Medicare open enrollment period, which is for Medicare Advantage and for people who are considering Medicare Advantage. As has been said, it runs every year from October 15th through December 7th. These have been the dates for Medicare open enrollment for probably for decades. So they're easy to remember. Any changes that you make to your coverage during this time period take effect on January 1st of the following year. The open enrollment period is your opportunity to make changes to your health coverage or your Part D drug coverage. And it is also the time to compare your options to make sure that you are enrolled in the right plan for you. Every year, by the end of September, if you are in a Medicare Advantage or Part D plan, you should get a document called the Annual Notice of Change from your plan. It's also called the ANOC. And the ANOC that everyone gets from their plan explains what their costs will be in 2024, any changes to benefits or coverage rules, any changes to the drug formulary that the plan has if you're getting Part D either through a separate plan or your Medicare Advantage plan, and any big changes to networks. So it's very important that you look at your ANOC every year if you are in a Medicare Advantage plan, even if you like your plan, because sometimes things change. Sometimes the out-of-pocket costs change, or maybe your very important preferred providers are no longer in network. So it's important to look at that every year. And during the open enrollment period, these are the actions you can take. If you're in a Medicare Advantage plan, you can join a new Medicare Advantage plan. Same with if you're in a standalone Part D plan. If you have original Medicare, you have the option to add Part D coverage as a separate plan, and you can join a new Part D plan. If you are in original Medicare and want to switch to Medicare Advantage, this is the time to do it during the open enrollment period. Or if you're in a Medicare Advantage plan and you want to go back to original Medicare, you can do that during the open enrollment period now. And again, all changes are effective January 1st of the following year. These are some of the things that a person should think about when they're considering a Medicare Advantage plan, or whether their current plan still meets their needs or if another one might be better. You can review the plan's estimated total cost to you, and you can do that if you use the Medicare Plan Finder tool on Medicare.gov, which I'll talk about in a little bit. See if the Medicare Advantage plan you're interested in has extra benefits that appeal to you. Again, vision, hearing, or dental coverage are the most common extra benefits, but many plans offer a variety of extra benefits that you do not get in original Medicare. The important thing to do is make sure that your healthcare providers are in your plan's network. There's a couple ways to do this. Unfortunately, you can't do that on Medicare.gov because the plans can change too often. The two ways to do that: you can either check with the plan that you are considering enrolling in and check their provider network, or if you have key providers that you just cannot do without. You can check with them and see what Medicare Advantage plans they are enrolled in for the following year. We have star ratings. CMS is really big on star ratings in a number of areas as a quick and easy way to help you just get a general idea of the quality of Medicare. We have star ratings for providers and physicians, but we also have them for Medicare Advantage plans. And of course, they range from 1 star to 5 stars, with 5 stars being the best and 4 stars also being excellent, but not quite as good as 5 stars. But you should always see if a plan meets your needs. A 3-star plan is not necessarily bad, especially if it meets your needs. Otherwise, it has your providers and the out-of-pocket costs suit your needs. So we do try to steer people away from 1 and 2-star plans, but people are certainly enrolled in those as well. The other thing is understand how the plan works with other coverage you may have. This is something I touched upon earlier as to why people are in, some people are in original Medicare, some are in Medicare Advantage. If you have retiree coverage or are still working in your job, still working and have coverage through your job, Medicare Advantage may not be right for you. If you have retiree coverage and you join a Medicare Advantage plan, you may lose that plan, that coverage, and not be able to get it back. Same with a Medigap plan. A lot of people like their Medigap coverage. If you cannot have Medigap and Medicare Advantage. So if you lose your Medigap coverage, you may have a very difficult time getting it back, or it may be a lot more expensive if you do get it back. So these are some of the important things that you should think about when you're considering a Medicare Advantage plan. I would advise against just relying solely on the information you get on TV commercials. I think our TV commercials, due to new regulations, the TV commercials that you see are, I think, better than they've been in years past. You don't see as many advertisements promising you things that really aren't available to you, but you should still be wary of what you see on in advertisements, whether it be on TV or flyers sent to your house or something. Just like with Medicare Advantage, there are things you should consider when considering a standalone Part D plan, or even the drug coverage in a Medicare Advantage plan. Again, when you use Medicare Plan Finder, and you enter the drugs, the prescription drugs that you take, you can get an estimated cost of what those drugs will cost you over the course of the year. You can review a plan's formulary to make sure that they cover the drugs that you take. If you have a Part D plan that you really like and it doesn't cover all the drugs that you have, you may have to work with your doctor to see if there's an alternative drug that you can take, or work with your plan to get a formulary exception for them to cover it. Different plans have different ways that they control costs, like prior authorization before they can authorize you to get certain prescriptions, or certain drugs, if they're more costly, they may want you to try something less expensive first to see if that works. And then if not, they would let you pay for the more expensive drug. We call that step therapy. Sometimes they will limit the amount of drugs you can get at a time. Although for most, at least maintenance drugs, you can generally get a 30 or 90-day supply. Pharmacies that people use are very important. Make sure that the pharmacies that you like to go to are in your plan's network. Again, when you use Medicare Plan Finder, you can put in your favorite pharmacies and make sure there's generally 3 levels of a pharmacy in a Part D plan. One would be out of network, which means that if you go to that pharmacy, you may be stuck paying the full cost of that prescription. Then there's in-network pharmacies, which are part of your network, your Part D plan's network, and you'll get good favorable costs with that. But then there's another level called preferred pharmacy. And at these pharmacies, you'll get the best price on your Part D prescriptions. So Ideally, you'd like your favorite pharmacies to be preferred pharmacies for your Part D plan, but also just as long as they're in network, they'll generally be fairly close. Sometimes your Part D plan will do mail order prescriptions. I like getting my prescriptions mail order. It's a lot easier. I don't have to go to the pharmacy to get them. It's some people like that, and generally they're cheaper if you get a mail order as opposed to the pharmacy. Like with our Medicare Advantage plans, you can check the star ratings of a Part D plan. And also, like with Medicare Advantage, if you have other coverage, you may not need Part D coverage because most other coverage, whether it's through an employer or retiree coverage, some people have TRICARE, VA coverage that will cover prescription drugs generally at least as well as your typical Part D plan. A little bit about Medicare Plan Finder. That is the tool. It's available on medicare.gov, and it is the best way to shop and compare plans. The best way to do it is if you can create a personal account on medicare.gov. You'll have to answer some questions just to verify your identity. But once you do and you log into medicare.gov using your personalized account, it will automatically fill all of the prescription drugs that Medicare has paid for in the last 12 months so that you do not have to enter them. They're already there. Then if you want to add drugs to that, you have the option. And it'll also show you the plan that you're currently enrolled in and what the expected cost for that plan will be for the upcoming year. You can also do what's sometimes called window shopping or anonymous shopping, where you just put in the zip code where you live, and then you can see the plans that are available to you in your zip code. That's generally how Medicare Advantage plans are available to people. Medicare Advantage plans are offered by private insurance companies. The federal government does not control which plans are available in an area or what service area. And generally, the service area will go down to the zip code level or sometimes generally the county level. If you use Medicare Plan Finder and you want to look at your drug costs, Plan Finder will show you some of the cost savings that you'll see due to the Inflation Reduction Act. If you use an insulin product, Plan Finder will know if that insulin product is in your plan's formulary, and if it is, it'll show on Plan Finder that you'll only pay $35 a month for that insulin product. That this was not available last year. The Inflation Reduction Act passed too late in the year for us to make that available, but it is available now. For our Part D covered vaccines, and I'll talk a little bit more about that, it'll show that those are available to you at no cost. And Part D coverage has certain levels of coverage. There's usually the deductible phase, the initial coverage phase, the coverage gap, which is sometimes known as the donut hole. And during that phase, you'll have slightly different cost sharing amounts. And then after that, there's a catastrophic phase. Up until the end of this year, a person with Medicare who reaches the catastrophic phase of coverage would have out-of-pocket costs for those drugs. And for more expensive drugs, they could be pretty high. And if you reach the catastrophic level of coverage, chances are you have some expensive drugs. Starting in 2024, so starting January 1st, there will be no out-of-pocket cost sharing for your covered drugs once you meet the catastrophic phase of coverage. And if you get extra help, low-income subsidy, that's a program that's available through the Social Security Administration. I'll talk about that in a little bit. If you get that, if you get assistance for your Part D coverage through that program, those costs will also be reflected in your Medicare Plan Finder. There's changes for that for 2024. There are currently 2 levels of extra help that people might qualify for. Starting in 2024, there's only 1 level. Everyone who qualifies at the the full level and has lower deductibles and cost sharing. And once you're done comparing plans for both Medicare Advantage plans and Part D plans, if you like the plan that you're currently in, you don't have to do a thing. You can just not do anything, and your coverage will continue into 2024. However, if you do want to change your plan, you can do that right there in Medicare Plan Finder. You can enroll in your plan right then and there. And there's other ways to enroll too. If you don't want to use Medicare Plan Finder to do it, you can also, an agent or broker or someone can help you enroll, or you can enroll directly with a Medicare Advantage plan sometimes. And then as was mentioned, when we talk to people with Medicare about Medicare open enrollment, we also like to take this time to talk about some of the other important changes for our CMS programs. And as Congresswoman Brown mentioned, the Inflation Reduction Act, it's a huge piece of legislation, and there are a lot of very important provisions in it that affect people with Medicare. One of them is, as we've already mentioned, is $35 insulin. If you take an insulin product, and you should make sure that you are enrolled in drug coverage that has that insulin product in its formulary. And once you do that, you will pay no more than $35 a month for your insulin per insulin product. So if you take 2 insulin products, that could be $70 a month, but it's still, this alone will save so many seniors a great amount of money, so they won't have to decide whether to get their insulin or pay their electric bill or buy groceries. So this will does a lot to help with that. So that's an important consideration, is just to make sure that the insulin product you take is in your Part D plan's formulary. One note, there are some drugs that you see advertised on TV. I can't think of any of the names of them right now, but they are drugs that people with diabetes take in addition to insulin. They are not themselves insulin products, and they are not covered by the insulin savings in the Inflation Reduction Act. This is a big improvement. Right now, as of 2023, this is January 1st, 2023. So we've been almost a year in this already. All CDC adult recommended vaccines that Part D covers are available to you at no cost. So there's 2 big ones with that. One is the RSV vaccine, which was just recently recommended for people over 60 years old earlier this year. That is available to you at no cost now at any pharmacy that you go to. And also the shingles vaccine. The shingles vaccine was previously not available at no cost to seniors, and that is a 2-shot vaccine, and sometimes people would have fairly costly out-of-pocket costs for each administration of that drug. So we do recommend, these Part D covered vaccines are typically ones that you can get at a pharmacy, and we recommend that you do get these vaccines at your pharmacy rather than your doctor's office. The doctor's office can usually administer a lot of these same vaccines, but there may be some out-of-pocket costs if you do that, and they would have to be billed from your physician office to your Part D plan. So that can get a little bit complicated. There are also some vaccines that have been covered under Medicare Part B, as in boy, and those continue to be covered under Part B and also at no cost. Those include the COVID-19 vaccine. There's a new COVID-19 vaccine out now. We recommend everyone get it. I got mine as soon as I could. The pneumonia vaccine is covered under Part B, and the annual flu shot is also covered under Medicare Part B. And these are some of the other provisions in Inflation Reduction Act that impact Medicare. I already mentioned the first one. people who reach the catastrophic phase of their Part D coverage starting January 1st, 2024, they will no longer have out-of-pocket costs once they reach that phase of coverage. Starting in 2025, all people with Medicare Part D will have a $2,000 annual out-of-pocket cap on their drug costs. So that's just their out-of-pocket spending, not including premiums, I think. But just like their cost sharing and deductible will be capped at $2,000. So right now, people, especially even when you reach the coverage gap, a lot of people typically have spent over $2,000 by that time. So again, most people will not reach that, but people with high drug costs, this is going to be a great benefit for them. And also in 2025, with the $2,000 out-of-pocket cap, that pretty much does away with the coverage gap, also known as the donut hole. And a big change starting in 2026 and every year thereafter. In 2026, you're going to people with Medicare are going to start seeing cost savings on 10 selected drugs that were selected because they are some of the most expensive drugs that Medicare pays for. And we're starting the negotiation process, I think, early next year. And people in 2026 will start seeing cost savings as a result of those negotiations. And then every year thereafter, we'll be selecting even more drugs that we will be negotiating the price of. And people will see savings for those. Another thing that we like to talk about right now is Medicare savings programs. The Medicare savings programs are available to people and they help pay Medicare costs. These are programs that are available through your state Medicaid agency. Medicare savings programs, there's the two most common ones are QMB, qualified Medicare beneficiary, and SLMB, SLMB, specified low income Medicare beneficiary. These are programs that are available to people with limited income and resources, and they will help pay your Medicare expenses. At the highest level, QMB will pay all of your Medicare premiums and all of your Medicare cost sharing. And at the other Medicare savings programs will pay your Part B premium, and that's it. But that's for 2024, that's over $170 a month that you don't have to pay. These are very important programs. One reason we're really touting them now is we suspect that only about half the people who are eligible for these programs are enrolled in these programs. So we're really trying to spread the word about them. As I mentioned, they are available through your state Medicaid agency in Ohio. That is the Ohio Department of Medicaid, and there's information on this slide here for how you can enroll. And this information will be shared with you, so if you don't have to copy it down right now. But these are very important programs, and they do help save seniors a lot of money. The other program I mentioned briefly is the Part D Low Income Subsidy, or Extra Help. This is a program that's available through Social Security. It has, just like the Medicare Savings Program has income and resource limits, this Extra Help does as well. They're a little bit higher than the Medicare Savings Program. So even if you don't qualify for a Medicare Savings Program, you may qualify for Extra Help. As I mentioned, through the end of this year, 2023, there are 2 levels of Extra Help, but starting in 2024, everyone who qualifies for Extra Help will qualify for the full Extra Help benefit. And that's generally 150% of the federal poverty level for a single or married couple. So if you think you're close to that, we really encourage you to apply for Extra Help through Social Security. Again, we suspect that only about half the people who are eligible for this program are enrolled in it. So we'd really like to see more people enrolled in these programs. A little bit more about Extra Help on the next slide. If you do get a Medicare savings program, you automatically qualify for extra help. Your cost sharing, if you have extra help, is very low. It'll be just a few dollars for generic drugs and a little bit more for brand name drugs. And your deductible will be eliminated, and you generally will have a plan available to you at no premium. Although there are other plans that you can enroll in with a reduced premium. So we do really encourage you to go to Social Security if you think you might qualify for extra help, and you can get some important savings there. And I've already mentioned this. The Inflation Reduction Act expands extra help eligibility so that there's only everyone who qualifies will qualify for the full level of extra help. One warning, I kind of mentioned this, beware of marketing fraud. We know that during this time of year, there's a lot of fraudsters out there who try to take advantage of people with Medicare, or who try to get you to enroll in a plan that they sell regardless of whether or not it is a good plan for you. So we do watch out and encourage you to watch out for people who pressure you to join their plan. You should never be pressured. You should be looking for a plan that meets your needs, not one that the agent wants to enroll you in. Be careful of people who say they'll give you something for free or who call your home without permission. This happens a lot. There are rules against cold calling people with Medicare to try to sell them plans, but it still happens. We just encourage you to just hang up the phone on these people. Some people are afraid to do that. They're afraid they're being rude, but that is perfectly all right. They're being rude to you by calling you. Some people will threaten you. They say that you'll lose your Medicare benefits if you don't sign up with their plan, and it's hard to believe, but people actually say that, and people get scared, and sometimes they enroll in those plans, and these plans are not necessarily good for them. So, and you should never give your personal information at an event where people are talking about Medicare Advantage, such as your Medicare number, your Social Security number, date of birth, or anything. That usually is not going to end well. If you can sign up for, if you're at an event that a Medicare Advantage plan is sponsoring, you can go to there and maybe sign up for an agent to call you to discuss plans, but never give your personally identifiable information like your Social Security number to someone who's trying to sell you a plan until you're ready to enroll. And these are some of the resources that are available on Medicare open enrollment and Inflation Reduction Act. Every year, our households that have people with Medicare get the Medicare and You handbook that comes out in September every year. It is a great resource for just to help you understand the Medicare program. If you have Medicare, you should have gotten one sent to your home. But if not, you can call 1-800-Medicare and they can send you out the general one. I hope a lot of you know about your state health insurance assistance program, your SHIP. In Ohio, that's the Ohio Senior Health Insurance Information Program, called OSHIP with a P at the end. OSHIP they are a group of trained Medicare counselors who can help you understand your Medicare benefits. Their busiest time of year is right now, as they can run Medicare plan finders for people to help them give unbiased advice as to what plans might be best to suit your needs. There's information on this slide on how to reach the Ohio SHIP. All of our SHIPs are really good. They're full of great people, but I want to tell you, you in Ohio, you have don't tell my other SHIPs I said this, but you in Ohio have an especially good ship there. They're a really good organization. The next couple other things I would like to talk about. A big program that's going on right now is Medicaid returning to normal operations. During the COVID public health emergency, the federal government gave state Medicaid agencies additional money to towards their Medicaid payments on the condition that they did not disenroll anyone from Medicaid for the duration of the public health emergency. Congress ended the COVID public health emergency for the Medicaid continuous enrollment provision on March 31st this year. And since that date, states have been returning to their normal process of redetermining eligibility for Medicaid, which is done on an annual basis, except for during the COVID-19 pandemic. But now we have nationally, Medicaid rolls grew by almost 33%. So there's a lot more people in Medicaid, enrolled in Medicaid right now. And we need to make sure that they're all still eligible for Medicaid. And if they're not, we need to try to transition them to other coverage. So some of the key messages that we have are, if you have Medicaid, to make sure that you have your contact information correct with the Medicaid agency. Look at your mail for any notices that you might get. And if you get a renewal form, to complete it and return it timely. These are very important messages. And some people will no longer qualify for Medicaid. And if they do, they may be able to get coverage through the health insurance marketplace. Or sometimes if they make too much money to qualify for Medicaid, that might be because they have they've got gained employment and they can get coverage through their employer. Or there are some people who turned 65 during the pandemic. They were enrolled in Medicaid, and because they were enrolled in Medicaid and they did not enroll in Medicare when they turned 65. While there is a special enrollment period for people who lose Medicaid coverage for them to enroll in Medicare. And if you use the special enrollment period, you would not be subject to any late enrollment penalties that you would have towards your premiums. And the last thing I would like to talk about right now is we are now currently at in the beginning stages of our marketplace open enrollment. Our marketplace open enrollment, the time open enrollment period for this has changed a bit in the 10 years that we've had it. Currently, it is scheduled, it runs from November 1st through January 15th every year. That is the set time right now. It starts November 1st. If you enroll in a plan and pay your first month premium by December 15th, your coverage will start January 1st. If you select your plan and pay your premium between December 16th and January 15th, your coverage will start February 1st. And the official place to enroll and plan there is healthcare.gov. So if you cannot have a marketplace plan and Medicare at the same time, but if you have family members who need coverage, this is the time of year to select Medicare Advantage or marketplace plan. You can compare plans at healthcare.gov similarly to how you can compare Medicare plans in Medicare Plan Finder. There's even a tool on healthcare.gov where you can just do a quick input of where you live and your expected income for the upcoming year, and it'll give you an idea of how much money you can save. Most people who buy plans through healthcare.gov off the marketplace do qualify for premium tax credits, and some of those you can apply towards your monthly premium. We call those advanced premium tax credits. And 4 out of 5 people who are enrolled in marketplace coverage have a plan available to them for $10 a month or less. So there's good coverage. All marketplace plans cover 10 essential health benefits. It's a good coverage and it's affordable for most people who are enrolled in it. So this is the time of year to shop in the health insurance marketplace if that is the coverage you need. I can turn it over to any questions that anyone might have.
Thank you. Thank you, Greg. I do have one question that came in, and if you have other questions, feel free to send them via message. The question is, what is the SHIP with a P contact number? And can you share any information that would be necessary to participate in that program?
Well, I'm not sure what you mean by participate in the program. You can get help from the SHIP, from OSHIP in Ohio at the toll-free number on this slide. That's 800-686-1578. They have people staffing phones, and they also have volunteer counselors throughout the state. So you can call that number, or you can go to their website. The website is on this slide. Whenever I want to find it, I just Google Medicare, Ohio Medicare SHIP, and it'll take you right there. They are located in the Ohio Department of Insurance. They're a great program, and they can help you. They can help answer your Medicare questions. Again, this is their most busy time of year, but they are so useful to people throughout the year, whether you're just turning 65 and you want to know about your options, or you had a claim denied and you want to know how to file an appeal, or you just want help understanding your benefits. They can do that. And also, like a lot of their counselors are volunteers. So if you're interested in working with the SHIP and becoming a counselor, you can call them and you can get training at no cost. And you can help counsel people on their Medicare benefits. It's they have a lot of they have a lot of volunteers who are actual volunteers, but then other organizations like hospitals and area agencies on aging, they will have their staff trained as SHIP counselors, and we also call them volunteers as well. But so there's two ways you can participate with that.
Thank you, Greg. And you must be very efficient because we have no other questions at this time. So I'll pass it back over to you to close out with feedback, and then we'll have the Congresswoman deliver final remarks.
All right. Thank you. Thank you for attending this session. We hope that it was informative for you. But we do like to get feedback. Anything that we can do to make our presentations better, anything that we can do better, or if you have any ideas for other topics that we can talk with you about, you can use the QR code on this slide. You can use the QR reader on your smartphone to get there, or there's a link on this slide. Again, this will be shared with you. And we do appreciate any feedback we can get on these, on our presentations, to see how we can make them better next time. Thank you.
All right. Thank you, Greg. And thank you to CMS for working with us to share this information with our constituents. I know that sometimes it can seem confusing to compare plans or research your eligibility or find a provider, no matter what age you are. But there are so many folks at CMS and HHS trying to make it easier, and so many local agencies here in Northeast Ohio that can also assist. So during open enrollment, please visit medicare.gov to find the plan that works best for you. And if you aren't on Medicare but looking for coverage, you can visit healthcare.gov to find a plan. So seniors watching, let your children and grandchildren know as well. And once again, thank you all for joining us today. And as always, if you have any questions, please contact us. We can help. Thanks again and have a wonderful day.
Thank you very much, Congresswoman.
Thank you, Greg.